Hello everyone, I'm Jessica Russo, a psychologist, currently in my second year as a PhD student in neuroscience, psychiatric and psychological sciences and movement sciences. My research project focuses on exploring the interplay between cognitive and motor functions in healthy elderly with immersive virtual reality. It is a study aimed at developing a home-based cognitive training program to improve complex gait. My research work is centered around the neuropsychological area, with a particular focus on understanding cognitive processes and their underlying neural mechanisms. In particular, a fascinating concept is the dynamic attention one. This refers to a set of attentional processes that allow us to process multiple stimuli simultaneously and make quick decisions in constantly changing environments. Imagine a lady standing at a busy intersection. She needs to selectively focus on several stimuli, as the moving cars or the pedestrians crossing the streets, or again, the changing traffic lights. But it's not just about choosing what to pay attention to. She must maintain her attention over time as well, as the environment is dynamic and constantly changing. The situation requires her to process multiple types of information, visual and auditory as well, while quickly making decisions such as when it's safe to cross. This ability to pay attention in a flexible and sustained way is closely tied to another phenomenon known as the cognitive motor interference, which is the competition between cognitive and motor processes. This phenomenon becomes more evident in situations that requires to execute a cognitive and a motor task simultaneously, and especially among the elderly who often struggle to coordinate attention and movement. And often it induces the subject to fall, with severe and several consequences on their health and quality of life. Our goal is to propose a cognitive training focused on dynamic attention, aimed at reducing cognitive motor interference in healthy adults, and so to reduce the risk of falls. To this aim, we will recruit healthy older adults and assign them into different groups. The experimental group will execute the multiple object tracking task known to stimulate dynamic attention processes. Instead, the active control group will be trained on other processes. Both trainings will be delivered at home, and participants will be assessed before and after the training period. Motor assessment will be done in two conditions: physical reality and immersive virtual reality. Participants specifically will be asked to execute single and dual tasks in order to obtain a measure of how much the cognitive task can interfere with the motor performance. Then they will be assessed on their cognitive performance as well with standardized tests, as for the psychological aspect through validated questionnaires. Here you can see some preliminary results from our first dynamic attention training session. The findings shows that participants improved their ability to track multiple moving objects in the environment and did so at faster speeds, all within a single training section. So, we expect after a dynamic attention training, the experimental group will show a reduced cognitive motor interference and improve dynamic attention performances. I believe this research could have several impacts, as it may provide evidence of how cognitive intervention can reduce fall risk, helping to prevent them in clinical population as well, and improving the quality of life for both patients and caregivers. At the end, it could also help reduce healthcare costs. So far, this is my research project, and thank you for your attention.